Hello, are you alright? Yes, are you? Perfect, right on time. Come on over and take a seat. All right, lovely. Good. Yeah, I'm good, thanks. Please get yourself comfortable. All right. Now I've got you some water. All right, so please just help yourself. Okay, my lovely. So, I'm Nicola, and I have been going through your notes from your colour analysis specialist. All right, and obviously I've been reading what you've emailed me over as well. So I've got a good idea on what kind of colours and different things like that. All right, but I am obviously a makeup specialist. I'm a makeup artist, so I am going to be colour matching you perfectly for makeup. All right, exactly. So I concentrate more on your skin tone, on your eye colour and your hair colour, and how it all blends together. All right, yes. So obviously you've been told that you're a spring palette. So for example, you match certain kind of shades like blacks, whites, creams, nudes, blues, and different shades like that, you know. But as I'm sure the other person told you, that you can also get away with different kinds of shades of things as well. All right, it's just kind of like a guide on what suits. But when it comes to makeup, I'm going to be just looking at your face. All right, okay, and then I'm going to be looking what matches. So first things first, do you have anything on your face? Perfect, so we have a clean base. Okay, that's good. So I know we briefly had a chat on the phone about what to expect, but just to recap briefly. So when I'm doing my makeup colour analysis, they are very different to if you just come to me for a makeover or a makeup trial. All right, so they are very similar to a makeup trial, but I go a little bit deeper and concentrate more on the colours. All right, it's very important for me to get the right colours. So the things that I'll be paying attention to, obviously I'm going to be colour matching you for a foundation and concealer. That's something that everybody should do across the board. All right, so we need to find a perfect foundation shade for you. Then when you've got that, you'll know roughly where you will sit with any kind of foundation shade. All right, then I'm going to be finding the right blusher shade for you, because believe it or not, if you're wearing the wrong blusher, it doesn't look right. All right, yeah, that's same with bronzer, contour, okay, and a highlight. Now different people look different in different types of highlighter as well, so that's good. And then finally, lipstick. All right, so them are the areas that I'll be concentrating on. Now I know you're sitting there thinking, well, that's like basically a full face, which it is, but I'm more about finding the right colours for you. All right, so when I like to do my colour analysis, I've got perfect eyeshadows for people because they are such versatile palettes that they've got pretty much everything in, you know, some really vibrant colours, you know, more neutrals and, you know, nice even shades. And what I'll be doing is popping them up against you. I'll be applying some. You might find that I'll be popping some on, taking it off, vice versa. All right, my lovely. Okay, so does that make sense? Good. And are you happy with what I'll be doing today? Yeah. Okay, so I won't necessarily be playing a full makeover in this session, but you could come back to me and I could apply everything that I've suggested. All right, yeah. This is more about finding the right shade for you and the right colours that suit your hair, your eyes, your skin tone. Yeah, and then you can kind of just wear kind of whatever with it, really. That makes sense. Yeah, okay. But obviously you will be having things applied to your face, but it's going to be more trial and error. All right, my lovely. Okay, Good. So before we get into it, do you have any questions for me? Perfect. If you do think of anything, please just give me a shout. So obviously we've got different types of foundation. All right, from what you've already told me, I would say we could get away with using a liquid. All right, that's fine. And other products, we could either use powder, liquid, a bit of both. All right, it's not an issue. Okay, that's fine. I'm not going to obviously colour match for any powders or anything like that, but I would always recommend with anyone that a good translucent powder is perfect. You're not adding any extra colours, so you're not altering your face colour, okay, from your foundation. Or a nice pink tone, it's nice around here, it's quite brightening, or maybe a lilac to brighten under the eyes, to brighten up around them areas are quite good. All right, and you know, but it's also finding something that you like. So if you want, say, more of a pinky tone under your eye, then go with that. It's quite versatile and suit pretty much anybody's skin tone. Yeah, all right, and same with like a lilac, because it's quite light and goes into your skin. It's not like you're adding a colour on top. So if you were going to say use a, I don't know, honey kind of shade, then you say went to put on like a translucent powder, it's going to be fine because it's just blends it in. But then if you're going to add a powder on top, say that's a chestnut or like a porcelain or something like that, then obviously it's not going to suit your skin colour. Does that make sense? Good, we're on the right track. So that's obviously always important. And when it comes to mascara and eyeliner and things like that, that's just personal preference really. I mean, I always tend to go for black because I just love how it looks on my lashes. But some people like to go for more of a brown, and again, that's perfectly fine. And you might find occasionally that you've got some funky colours coming out. Like the moment I'm seeing blue, pink, burgundy or whatever. But, you know, I wouldn't necessarily recommend that for everybody. Again, it does depend kind of if that's going to go with your eyes. Yeah, but again, that's totally down to you. All right, and same when you come to do brows and things like that. You know, I like mine to be kind of like this. Some people like them darker, some people like them lighter, but you know, just try and make sure it balances because they do frame your face, so that's really important. Okay, and then it's also good to make sure that you've really good cleansed and moisturised before you pop any makeup on. Does that make sense? All right, you want to really hydrate your skin, make it nice and supple, and then you want to make sure that you are using a primer. Okay, now there's all sorts of different primers. Okay, ones with like a tintin, ones that aren't, one's got shimmers, different type of textures and things like that. You've got to find the right one for you. Okay, that's down to how they feel on your skin and if they are a good quality. All right, yeah. So I don't tend to go through any kind of setting sprays or primers and things with people because, like I say, it's a very personal choice. And then everybody's skin is different and they absorb differently. All right, so that's one of those things that if you know a brand or you like a brand, try it, see what you think. All right, yeah. Exactly that. I mean, I quite like this one. This is Charlotte Tilbury, and this is the Brightening Youth Glow, and it is sort of a bit shimmery. All right. I do like the Giorgio Armani one, illuminating one. That's quite nice. And I like the Be Perfect Champagne Glow priming one. That's really nice. Yeah, so again, it just depends on what it is that you're wanting and what suits you. Okay, good. I will be writing all this down for you and I'll be sending you over in a report so you'll have all this information that I've just discussed. All right, good. So I hope that's some help to you. Perfect. Right, lovely. Okay, so we understand all that and what we're doing. So let's go on to the colour matches. Right, my lovely. Let's begin. So, what I'm going to do, I'm going to just pop on all the different shades that I have. Now, looking at you, I've got a rough idea of what I think shade is for you, but I'd just like to do this, if that's okay. Good. So, let's go through the different shades. Now, don't worry so much about the brand, okay? Just make sure you go with a good lasting one, all right? Yeah, some are better than others. And you can see the consistency. Yeah, I do like the Be Perfect foundations, the Giorgio Armani foundations as well. Estee Lauder's quite good, the double wear. But again, it's personal preference. And again, different people prefer different kind of textures and brands anyway. I wouldn't worry too much about that. Okay, let's just do this last one that I'm going to be using. I do have different types of others. I've got ones that are like a BB cream and like a tint and different things like that, but I'm not going to bother with those. Okay. Lovely. All right. Okay, let's start with this shade. Okay, slightly turn that way for me. Thank you. Okay, that's the one. Okay. Okay. Okay, let's put this one on. Okay. Is that feeling all right? Good. That's perfect. few more moments. So, the way foundation works is the shade that you can't see the most is your shade. Okay. So, if you've got say a line, 2 other lines, and one of them is really, say, pale and you can see it really clearly, the other one's really dark and you can really see it really clearly, then there's another one that you can't actually see there. It just looks like your skin. That's the shade that you should be wearing. But it can also be very difficult when it comes to different brands, different types of foundations, and if there's different colours, some of them have reams of different shades. So sometimes it can be quite hard to find your right shade with different brands. Alright, but as long as you know what kind of tone you should be going for, if you should be getting, say, like a neutral or a cool tone or a warm tone, you sort of know where to go straight away. And then you can break it down a little bit further. Alright, so just to give you an idea, so whatever shade I kind of say you are, then you can go away and have a look at that kind of shades. Alright, okay, yeah. But some people like to get the lighter shade so they can work their way up to, you know, more of a darker shade but more balanced. Some people like to start with a dark shade and keep going darker, or some people just like to keep it kind of that kind of shade. Alright, but my advice will always be try and get your closest match. Alright, and sometimes it's not possible to get it bang on. Okay, but that is your base. Okay, so to give you that nice finish. Okay, and same with the concealer. You want the concealer to match your foundation colour. Alright, yeah. And then I would say pop on obviously your base primer. Then I would pop on the foundation, 1 cover, 2 cover, it depends how many you need to pop on. Okay, I tend to pop on a layer, then I will go again, then I put a little bit of concealer on. Alright, and then I'd move on. Okay, so that's kind of what you'll be needing to do, if that makes sense. Good, perfect. And then obviously, you know, you just build up then with the products. Now let me have a look. Yes, that's what I thought it was. Perfect. I was stuck between the 2 shades, but you know. Okay, I'm just going to remove those. Okay, perfect. Right. So obviously I've wrote here what the shade would be and in the matching concealer, but when I do your report I will write obviously a summary on it to give you an idea of, so you know where to go. Alright, yes, you're not just going to be lumbered with these numbers and then that's it. I'm going to give you an in-depth analysis. Alright, so you know when you say go down to Boots or Superdrug or wherever it is you go, you can go in and go, right, go into that brand, let's look at this side of the chart and do that. Alright, my lovely. Good. So, now I'm going to move on to blush. Right. Okay. Make sure this is clean. Now I'm going to start with the liquids. Alright. Now, what kind of shade would you usually wear in a blush? Okay. Right. So this is called Rosie. Okay. Now, please bear in mind as well that in a bottle or on there, it's not necessarily going to look the same as it would on your skin. Okay. This is called Pretty Pink. Okay. This shade is Apricot Dream. And then we have Just Peachy. And then we have Blushin'. Okay. So that so far. Now these ones I can't pop on there because they're a sponge. So I'm just going to dab, okay? Okay. That's very pinky. Now this one is called Bon Bon Baby, okay? Then this one, you can use this as a blusher or a bronze, or kind of mix it in. And this is called Baked Biscuit, okay? Okay, I'm thinking that's a little bit too pale. Right, let's get these on you. Okay. How are they feeling on you? Good. Right. So. Wonderful. Right. If you could just look in that mirror for me, please. Okay, now which shade do you like the look of on you? Bear in mind you've got no base on, but you can still see if a blush is good or not. Yes, okay. Yeah, okay, that's fine. Now I'm going to look at you and see which one suits you the best. So okay, that's good. Okay, that's good. Let that dry. Now, this is Blush Baby. Okay, so you can get obviously matte ones, sheer ones, shiny ones, and different things like that. Okay, let's put that there. Ones that have got sort of like a highlight in them. Okay. I like that one. Got that kind of shade. And that one. Okay, don't like those. Not very nice shade. Now have a look in the mirror and let me know what you think. Yes, I 100% agree. Yeah. Okay. I think this one, it's quite nice on you. Yeah. Okay. Okay. Now, which did you like the feel of? So with a powder you can obviously apply it and keep making it thicker and thicker and fuller. And with a cream obviously you can keep dabbing it on, but obviously a cream is going to be thinner than what a powder would be. Yeah, I mean, some people like to pop a cream on or a liquid first, then pop some powder on top. Yeah. And just brush it up a little bit or keep a similar shade, or you could kind of blend. So for example, I know this shade I don't think would suit you, but pop this on and then you could like blend a little bit of that in. Do you see what I mean? Yeah. It kind of just depends a little bit really about what kind of look you want. Yeah, there's so many different ways that you can tweak with it. I mean, I'm going to show you. So I'm going to pop on Pretty Pink. And Rosy. Let's get a brush. Okay. Now you can pop liquid on with a sponge even. All right. Okay. Very similar kind of shades. Okay, just have a look in the mirror. Yeah. Okay. I'm going to pop a bit of this. Okay. Underneath. Then have a look at the difference with that. See what I mean? Yeah, works quite nice. Okay. Right. Let's remove those off your face. Okay, lovely. Okay, lovely. Yeah, definitely. Exactly that. Just show you a little bit of this. Okay, now have a look at that. Better? Yeah, you can see the difference. Right. Now, different contours that you can have. One's like a stick, so you can draw a line. Just going to draw one. Okay. Some people like to go really dark. Some people like to go lighter. Some people like to go different tones. It just depends on what your preference is. Then you've got that kind of shade. Okay. I'm going to use this. Let's get a bit more out of that. That's it. Okay, so this is this one. And then another kind of shade, be a bit darker again. Obviously you can rub, you can dab, just depends. Then highlight. You can use powder, you can use liquid. Got a real light one there. Okay. And okay, what do you think? Have a look in the mirror. Just wipe my hands. Which do you think looks nice on you? Yeah, I do agree. Okay. So we want to with the highlighters, it just depends kind of what you're wearing already on your face. Yeah, and what kind of shade you really want to go for. And that we want that shade. That. Okay, that's good. These ones that I do have are like a liquid blush, but they also have highlight in. But they're quite thin. This one's more like a bronze kind of highlight. Okay. So let's get that off your face. Perfect. Right. So when it comes to makeup, it's all about being creative, you know, just letting go and being artistic, all right? But even if you're not, you know, just experiment a little bit or just go with it. You know, don't be scared of it. All right. Now, this palette has a range of different colours. And I always like to get this out when I'm doing a colour match. Alright, so just look at me. Pop it there. So you have obviously mattes, you have shimmers and glitters and different things like that, okay? There's always different kind of shades to go for. Right, so let's have a go at some pinky colours. Okay, good. Okay, close your eyes. Keep your eyes closed. Let's go for that one. Open. Lovely. Have a look. Nice. Them kind of shades would look nice. So you can kind of get away with any of those kind of ones, really. Yeah. Okay. Now, the next ones I'm just going to pop here next to your eyes, okay? Let's try this kind of shade. Okay, have a look. Yes, them are the shades that I think would work well with your hair colour, your eye colour and your skin tone. Alright. But you can pretty much be quite flexible, especially when it comes to more of a nudes, pinks and different colours like that. Yeah, even like these kind of shades are quite nice. They would work well. They would work. Probably not those. They wouldn't go very well. Then would be probably a little bit on the dark side as well. Alright. And this is another good all-rounder, which I tend to get out. Okay. So this section with the nudes, browns, that's going to be quite versatile. That's good. Purpley shades and the bright pinks, I think they're a bit too much. Blues, greens, probably not so much. Now, it's always good to have one of these lighter shades over everywhere, and then you can pop one colour on, you can put two colours and blend, you can do corners, there's all sorts of different things, but obviously I'd have to get you in for a makeup trial for that, and that's where I can, and tutorial where I can tell you how to apply, where to apply, and different things like that. Alright, but obviously we're just going through the colours today, so these are going to be good. Alright, and some of these would suit you as well. Alright, but then that goes with the spring palette. And you're lucky enough to have the eyes to suit. Now, this is one of my favourite palettes at the moment. So I like to use this and especially highlight by the brows. I'm wearing this today with that, this and that as well. Okay, so just, you know, help yourself and kind of, you know, I wore this last week and I think, was it that the other week? I can't really remember. But, you know, these are quite nice. These kind of shades you're going to be perfect in. This palette is kind of made for you. But if you want to divulge into, obviously, colours, then you can go more pinky and things like that. You know, maybe some like blues and different shades like that. Maybe some greens. All right. Sticking with the spring palette as well, and because your eyes are perfect, so what I will actually do for you is when I'm writing about eyeshadows, I will tell you what I've just said and then I will go a little bit deeper, all right, and give you a really good breakdown of what shades and things like that. No, we don't want those. I don't have blush, it's fine. You can get liquid eyeshadows, you could get like crayon eyeshadows, different things like that. That work really well for you, it's lovely. And that would. Probably a little bit too green. Close your eyes. Okay. Right. Perfect. Now, you could definitely get away with obviously clear glosses. Any kind of nude kind of lipsticks is fine. So like something like that's good. That's quite good. That could work. So any kind of nude shades, any kind of pink shades would be nice as well. Okay, if you're going for a bold eye, maybe more subtle lip, vice versa. Maybe certain shades of red. Nothing too pale, like too, not too nude, and it's going to flush you out too much. Yeah, and I think people make that mistake sometimes. I mean, nudes are very attractive and nice, but I think it has to work with the right kind of shade. Okay, I'm going to pop on a shade and see what I think. Oh, that was a bit dark. Have you ever wore a red lip? Okay. Okay, if you give me your hand. Okay, those two shades I think would work really well. Now I'm just going to pop this on your lips, okay? Okay. Okay. Perfect. Now, have a look. Good. You might as well keep that one on. It's fine. So, lips, we've got nudes, pinks. Could get away with a red. Okay. No plums or purples or anything like that, okay. And not too pale. And try to alternate between. So pinks will definitely be good for you though. You could probably get away with all shades of pink, but not too purpley. All right, avoid the purples. Okay. Okay, but I will write all this down for you anyway. Again, with the lipsticks, I will go into detail. And obviously, if you do use a lip liner, you will want to use a lip liner to match your lipstick colour. Some people like to completely go darker than their lipstick and that, but personal opinion, keep it the same. But each to their own on that one, I suppose. Right, my lovely. That is your makeup colour analysis complete. I hope I, gave you some useful information. I hope you found it interesting, and obviously I will write all that up with a lot more information. I'll pop you in relevant information leaflets, all sorts of things like that. I will get to you. Alright, so when you get it, make sure you have a good read through it so you know what's what, okay? So obviously I'll give you information about the types of foundation that I think you should be wearing, blush, different things like that, and how to wear it, where to place it and things like that. But if you do want to actually have a makeup trial with me, a sit down and actually get me to apply the makeup on you, and you know, or do you a tutorial on how to apply eyeshadow and different things like that, then I can book you in. Is that something you're wanting? Okay, my lovely. So when would you like to come in? Okay, well, the report I'll try and get to you by the end of the week. All right, yes, and so week, and that will be quite detailed. Now, when you get it, I want you to have a really good look through it, okay? Don't leave it and just leave it sitting there. I want you to really look through it because I need you to go through it before you come to me. All right, and then so you want to like a trial / tutorial, and with application. Okay, could get you in about 4 weeks. How's that sound? Yeah. What I will do is I'll double check my diary, everything like that, and I will email you over an appointment slot, probably about 9 o'clock, same day. Okay, but I will confirm it when I send you over your report. Okay, perfect. When you do come, make sure you've got nothing on your face, all right, and then we can do a full application. And, you know, I can tell you where to apply something as I'm doing it and things like that. All right. You are very, very welcome, lovely. And it was an absolute pleasure to meet you. And I hope that is useful for you with obviously your other colour match that you had. And you can pop it all together and get yourself a nice outfit, get some nice makeup and treat yourself. All right, but don't do anything until I've sent you over the report. All right. You're welcome. You take care now. Bye-bye. Hello, lovely. How are you? Not too bad. That's good. Yeah, I'm good, thanks. It's nice to meet you. I'm Nicola. I'll be carrying out your ear cleaning today. Have you had one of these before? Okay. Yeah, well, it's a little bit different to your typical ear clean. Alright, so as you can see, I've got all sorts of different things here. Alright, I'm going to start by having a look in your ears and just checking your hearing a little bit. Alright, then I'm going to be cleansing, I'm going to be steaming, exfoliating. Alright, I'll be removing any wax or any build-up or anything like that from inside your ear. I will be using some special candle to draw out any wax as well, just to make sure. I will be doing an extraction if you have any blackheads, alright. And then just a general, you know, wipe around, make sure your ears are okay, and just finish off by checking your hearing again. Is that alright? Good. Yes, it is quite intense. There is a lot going on, but it's not just your standard ear clean where you come in and I'm just removing all the wax and everything like that. That is included as well, but a few other bits and bobs as well. Alright, good. Now, are you happy with that? Perfect. Now, as you can see there, you've got some paper towel and an apron. If you can pop all that on for me, that would be really great. Okay, make sure your hair is back out of your face. Alright? Perfect. While you're doing that, I'm just going to get myself ready. Okay. So. I'm just going to start by having a look in your ears, okay? Right, are you all ready? Yeah? Okay. Right, so have you been having any problems with your ears? Okay. So maybe a little bit of fullness, muffledness. Okay. A little bit of itching. Alright. Okay, well, I'll have a look. So, no hearing loss that you've noticed, or any infections or major problems? Okay, well, I'll have a look anyway. Can I begin? Perfect. Alright. And in we go. I can definitely see some blackheads just on the inner bit. And around the top bit there, that could do with a good clean. Just have a further look in. The wax buildup is not too bad. Yeah, it's not that bad. Okay, just have a look behind. Yeah, you could do with a good clean behind your ears too. Alright, other side, and in we go. Yeah, so a few blackheads as well, and a bit of cleaning needs to be done at the top. Let's just go deeper. Yeah, not much wax build up, but a little bit. Just behind. Yeah. Okay. Okay. Now, can you hear this? Okay. Good. Perfect. Excellent. So you can hear all that. Okay. Perfect. Now, can you hear that? Right. Can you tell me how many times I tap? Okay. That's fine. Perfect. Okay, now this is going to make a hum vibration sound, okay? Now, I'm going to tap it. You can tell me if you can hear it. Okay, good. Good. Okay. Now I'm going to wave it across. Okay. Which tell me if you can hear it in both ears. Good. Now I want you to tell me when you can't hear it anymore. All right. Okay, and again. Okay, well done. Right, so put this in your ear. Okay. Right. Right, it's going to feel really strange, okay? You're going to have all sorts of different sounds and feelings in your ears. Okay? You're ready for me to begin? Anytime you do feel like you want me to stop, please just give me a shout. Okay? Good. Are you okay? This will feel warm. Is that all right for you? Okay. Okay, let's do the other side. Okay. Is that okay? This will feel warm. How was that? Good. Strange. This is an exfoliator. Okay. ears feeling okay? Good. Right, I'm now going to steam. Alright. Is that okay? Is that feeling alright? Good. Once I've steamed, I'll do a bit of extraction on the blackheads, okay? Just a tad longer. Okay. Just a little bit longer. That should be enough. I'm now going to do some extraction. Alright, keep nice and still for me. You're doing good. It's coming out well. Okay, let's try the big tool now. Okay. Good. Okay. Perfect. Now this is just some aloe vera and tea tree. Okay. No, it shouldn't sting. Alright, because you haven't broken your skin or anything, okay? Is that alright? Good. Okay. Lovely. Right, let's do the other side. Okay. Good. Okay. You okay? Good. Right, I'm going to try the big one. Perfect. Does that feel okay? Good. Okay, so the aloe and tea tree. Right. I'm going to let the tea tree just soak through, okay? And while that's doing that, I'm going to flush your ear. Alright, I'm going to work on the internal part of your ear. Alright. Right, now this is warm. Okay. Okay. Okay, other side. Okay. Okay. I'm now going to pop this candle in your ear. This is just drawing out any extra wax. And any impurities and things like that. And I'm going to pop it in the other side. Okay. All right. again. Okay, I'm just going to tone. Close up all your pores. And again. Okay, I'm just going to have a look. In we go. Perfect. It's all nice and clear. Good. And in we go. That's good. That's all nice and clear too. Perfect. Now let me just check your hearing. Okay. Can you hear this? You think it's a little bit louder? That's good. Okay, now I just want you to listen to this. And you can hear that. And you can hear that. Good. Your ears should be nice and tuned now. Well, my lovely, how's that for you? Good. Well, I'm glad. So your ears are clean internally and externally. Okay, I've got all the blackheads gone. Get a really good clean. All the wax is gone, and your ears are looking perfect. All right, my lovely, and there's definitely no signs of infection or anything like that. All right, now just keep on top of it now. Make sure you give your ears a nice clean every so often, you know, and clear around the back, around in here, and inside. Don't use them Q-tips, and if you do, just use them sort of on the edge, and make sure that you are drying your ears correctly as well. All right. Okay, but feel free to come back at any point, and I could just do a clean, or I could do internally or just externally, or both together as I have today. All right. Okay, do you have any questions? Okay, we can carry on as normal, but just be warned when you go outside that things might be extra loud. All right, so if you've got some ear muffs, that might be ideal to pop on. Oh, you bought them, perfect. Yeah, so you can pop those on, that would be really good. All right, and then just, you know, carry on as your day as you would normally, but don't get your ears wet or anything like that for 24 hours, because all the products and everything that I used, I really want them to work now, if you know what I mean. All right. Okay, you're very welcome. You take care now. Bye-bye. Hello, lovely. Are you all right? Good. So I'm Dr. Nicola. It's nice to meet you. I'll be carrying out your skin assessment today. All right, and I believe that you're a little bit concerned with some breakouts that you've been having. Is that right? Okay. Well, not to worry. I'll have a good look for you and see what we can do. Okay. Now I'm just going to pop on some gloves. Okay, am I alright to take off your glasses? Okay, just pop those there for you. Let's pop that there so I can see. Okay. Close your eyes for me. I'll look in your brows. Okay, so you don't have any breakouts in your brows, but I've noticed that you do have a few here. A little one there, and they've got what's under the surface. Just feeling over your face as I'm rubbing over your forehead. I can feel some little lumps underneath your skin. You may have felt it yourself if you've touched your face. But here, some breakouts, and I can see some little lumps under the skin, but they're not quite a breakout. Just rub over your cheeks. So I can feel some lumps and bumps. A few this side, but I feel like there's probably more lumps there. Okay, let's feel over your chin. There's definitely lots of lumps there. Some blackheads. Can you tilt your head back? Okay, back. Okay, so your T-zone seems to be where the main problem is, okay, which is your forehead and down there. And that's usually where we have a build-up of oil, okay. Now the oil's called sebum. So we have glands on our skin, and they're next to hair follicles, which is the holes where the hairs come out of. And if you produce too much sebum, then that sebum goes into the hair follicle and can block it up, and that's what causes breakouts. And ones that are open are usually, you've got a black head in there. The ones that are closed, you have a white head, which you might see some of those. But then you also get like proper spots, which are like papules, pustules, nodules, different things like that. It's very complicated. You definitely do have some proper pustules there, which are your proper like white head spots, which is here, 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 probably there. That one not so much. Now your face doesn't feel particularly oily, doesn't feel greasy to touch. Okay. Do you ever find that it feels oily when you touch your face? Not really. And if you do, it will probably be more this section. As a teen, pre-teen, spots, breakouts are very common, especially across the T-zone. And sometimes on the cheeks, and it can be like here, which is like hormonal. Okay, but that seems to be alright. get my light. Okay, close your eyes. Probably a little bit of a breakout in that brow. Close your eyes. Looks all right. Okay, we can turn that. Cheeks are nice and hydrated, which is good. Okay. That cheek's good as well. I think you're a little bit dehydrated on your forehead. A little bit, yeah. A little bit dry around there and there. I feel like you've got a lot of dead skin build up on your face. It's like when I'm doing that, you've got bits of skin flaking off, which is dead skin. Which is probably what's happening is, you know, your follicles, your holes where the hairs come out of. If you've got oil in there and then you've got dead skin mixing in with the sebum, and that's what causes spots. So like dead skin, say over here, and oil's gone into that when usually you'd have a hair, and then it will block it up, and that's what's causing the spot. That makes sense. But if you're going like that, and then dead skin's not falling off, so it's trapping more dirt, more spots, you know, more debris into your follicles, causing more spots. So we need to exfoliate. Does that make sense? Little scratches there. From a cat. Bit dry patch there. I'm just going to rub your skin in places just to see if you go red. Maybe a little bit. So it's more just on the cheeks that go a little bit red. Does your skin on your face ever feel tight? Just when you're sitting there, does it feel really tight and stretched? No? Okay. Does it ever feel sore? No? So look under your eyes. So you don't have any dark circles, which is good. There's a slight little bit of darkening there, but that's quite normal. You look quite hydrated as well, which is good. Freckles in a few places. Just a few. Not too many. Your nose has got a mixture of blackheads, whiteheads, and the pustules. Look up for me. That's good. Close your eyes. I'm going to gently touch your lids. That's nice and hydrated too. Right, I'm just going to take a few different samples, okay? Okay. Okay, close your eyes. face with this. Does that feel okay? Good. Right, I'm just going to let that soak. And then I'll take another couple of samples. Okay. Okay. Smile. Scrunch your face. That. That's it. Relax. Puff your cheeks out. Relax. Close your eyes. I'm going to puff some air on your cheeks. Okay. Do a little bit red here. Okay. I'm going to gently tap your face. Good bounce. Okay. So your face is really hydrated, okay? A little bits on your forehead, so we can try and up your water a little bit, but I think it's not really the water intake. I think you're needing some kind of moisturiser on your face, okay? I think the main problem is you need to be using a good cleanser to make sure you're really cleaning your face, okay? And you need to be using a toner to block up these holes so you're not getting more bacteria, germs and dirt and all sorts of different things in there causing a spot, okay? And we need to use an exfoliator to get rid of all of that dead skin, okay? So if we could come up with something where we do a good cleanse, exfoliation and a moisturiser, okay? and obviously a toner. So we do a good scrub, scrubbing all our face, getting in all the areas right, so it's all frothing up. Rinse it all off. Then I'm going to do really exfoliate, but nothing too rough because you do get a little bit red on your cheeks, so we want it quite gentle. Yeah. And then you want to put some toner on it to close those pores, and then we'll put on a nice moisturiser to add all the moisture back in. Okay. And we could probably carry out some extraction on the nose area as well, and a little bit on the chin, and maybe just across there. Yeah. Okay. So other than that, I think it's good, and it's quite common for your age, okay, to be experiencing things like this, especially as people grow up and go through puberty. People develop spots and different things like that. So do you have any questions? Okay, I will take the samples off to be assessed, alright, just to see if there's any kind of bacteria on there or anything that could contribute to acne, and we can just have a good look. Okay, so if you want me to pop your glasses back on, do you want to do it? Okay, perfect, let me just have a look. I'm just wondering if it's where your glasses are sitting, but it's not, so there's nothing to do with that. Okay, my lovely, it's nice to meet you. I will come up with a plan and I'll write it all down for you, and then we can sort the appropriate skincare and go from there. Alright, you take care now. Bye bye. Hello lovely, are you alright? Good. I'm Nicola and I'll be carrying out your scalp check today. Let's get you in a comfortable position. You comfortable? Ready for me to begin? Okay. Can you bend your head down? Thank you. Okay, come on, back up. Pop your head back. So your hair is quite oily here at the top. You do have some like oily bumps throughout, which look like dandruff. Have you noticed them before? see what I mean. Don't wipe it. here? No? A lot of build up here. You try and use a good scalp cleaner and exfoliator just to remove all this build up that we've got here. Okay. This is just removing any build up. It's on the follicles. Have you been having any itching there or not? Can't remember. Got quite a bit of build up here. A little bit of oil on there. Okay, I'm just going to pop a special product on there, alright, and then just give it a massage, and that is the appointment finished, okay? Feeling okay? Good. just leave that product on, alright, for at least 24 hours. It's so can do the job. Okay. That's the main section where you're experiencing dryness and flaking and product build-up. Could do with using a good scalp scrub. Scalp cleanse. I know this is not your proper parting, but I'll let you do that. Okay, does that feel all right? Okay, so what I will do is I'll pop you up a hair prescription, okay, and it will be emailed to you. If you can go and get that ASAP, that'd be some scalp cleanse, scalp scrub and conditioner. All right, it will have the instructions on there as well, how to use them. All right, okay, do you have any questions? All right, lovely, well I will see you in 4 weeks, okay, and we can go from there. You take care now. Bye-bye. Hello, lovely. Are you all right? Good. Yeah, I'm not bad, thanks. So, I have you in for a yearly health check. Nice to meet you. I've not seen you before, but I believe you've been a patient here for some time. Great. So, I'm Dr. Nicola, and you are? Great. Just checking I've got the right patient. Wonderful. And your date of birth? Thank you. Right. What I'm going to do is get straight into the exam, and if I've got any questions or anything like that, I'll discuss that towards the end of the appointment. Alright, so please think of any questions you'd like to ask me, and we'll talk through that a little bit later. Alright, my lovely. Good. So, how are you feeling in yourself? Okay, I'm doing alright. Good. You're not concerned about anything in particular? Okay. Alright, well I'll do my checks and then we can have a little bit of a chat. Alright. So, I'm going to start off with just checking your temperature, if that's okay. Okay. Right, I'm just going to pop this inside your ear. Okay. Great, and just check the other side. That's good. Okay, so temp. Wonderful, that's good. I don't know whether you've seen one of these or not, but I'm going to pop this on your index finger and it's going to measure your pulse and oxygen levels. Okay? Right, if I can have one of your fingers. Thank you. Now just relax for me. That's perfect. Great. Okay, you can relax. Great, that's good. Now, going to get my stethoscope, and I would just like to listen to your heart and your lungs. All right. Okay, I would like you to just breathe normally. Okay. Okay, we need to get down onto your chest. Okay. When you're ready. Thank you. Okay, if you take a nice deep breath in, hold it, out, in, hold, out, in, hold, out, in, hold, out. Okay, can you just cough? Cough? Great. Just going to pop it at the back. Take a nice deep breath in. Hold it. Release. Normal breathing. Take a nice deep breath in. Hold. Release. Okay, thank you. All sounds nice and clear. Okay, so your heart and lungs sound perfectly fine. Alright, not concerned about anything there. Okay. Now, I'm going to take your blood pressure a little bit later. Alright, I like to do it a little bit later through the appointment. Okay, my love. Right. Did you bring a urine sample with you? Perfect. You can just pop it on the side for me. Thank you very much. Okay. Now I'm going to get you to blow inside of this peak flow monitor. Alright, just want to see how much oxygen you have. Okay. Okay. Round mouth on it. That's it. Close it nicely. Okay, you want to take a nice big. Okay. Let me take that. Okay. And when you're ready. Okay. Not bad. And last time. bad. You're not asthmatic, are you? Okay, so peak. No. It's not bad. It's probably a bit on the lower side, but that's why I asked if you were asthmatic. But you know, have you been having any problems with breathing or any heaviness in your chest, pain or breathlessness? Okay, so just keep an eye on that. It could be if you're feeling a little bit anxious and overwhelmed that you're here. Alright, but I will keep an eye on that. I might get you to come back just to check that. Yeah, I mean, you're averaging around 400, which is quite low for somebody that hasn't got asthma. But for an asthmatic, that's probably it's a bit higher on. Yeah, so I just want to keep an eye on it. Okay, that's fine. Nothing to worry about though. Like I said, sometimes if you had a cold, flu, or you know, you may be anxious and things like that. All right. Okay. Good. All right. I'm gonna have to put some gloves on now. Okay. So, in for the full works today, so we'll have to take some blood later. Okay. Right. Okay, I'm going to have a look in your mouth. Okay, so I've just got my depressor. Right, if you open nice and wide for me. Thank you. Right, how's your oral health been? Your teeth okay? You up to date with your dentist appointments? Okay, haven't you been having any mouth issues or anything? Okay. Okay, pop your tongue right out for me. Curl it up. Okay, and back. Right, say R. Good. Okay, I'm going to pop this in. Say R. Okay. Okay. And again. Okay. Alright, just going to get your that's it. And the upper. Okay, looks good. Thank you, relax. Just need to sanitize. Okay, I'm going to have a look in your ears. Have you been having any problems with ears, any hearing issues, any pain or anything like that? Okay, good. Right, just relax for me. And in we go. Looks good. Yeah, looks really healthy. There's a little bit of wax, but it's quite a normal amount. Let's go a little bit deeper. Yeah, no signs of infection, no swelling, no inflammation, no redness. Looks all good. Okay. Right. Okay. Other side. Here we go. nice and clean. Let's go a bit deeper now. No swelling, no redness, no inflammation, no signs of infection, so it's good. Perfect. Great. I'm happy with that. Just going to feel around your ears if that's okay. All right. That all feels good, and I'm guessing you had no pain. Good. Now I'm just going to see how your hearing is. I just want you to tell me if you can hear what I'm doing, alright? Ready? Okay. Now I want you to repeat what I'm saying. Doctor Nicola. Beautiful. Pretty. Stable. Buttercup. Roses. Flowers. Pineapple. Vegetables. Sausages. Chocolate. Delicious. Perfect. Well done. Very good. No problems with your hearing. Okay, but if you do have any in the future, please come back or go and see maybe an ear specialist or something like that, just to keep on top of your hearing. But as far as I can see at the moment, there's nothing flagging up to me that you've got any issues. Alright, okay, that's good. Right, now I'm going to have a feel around your scalp, and I'm going to come down, check your sinuses and your glands. Is that alright? Okay, my lovely. Alright, stay there for me. Okay. feels all good, and I'm guessing you didn't feel any pain. All right. Okay. Okay, open your mouth, close, open, close. Now can you do a chewing action? Okay, and now yawn. Okay, I think that's good. Okay, that feels good. Right, now I'm just going to feel it down your arms. Okay. Bit clunky. Give that a while, or okay. Any pain with it or anything? Okay. And the same that side. Okay. Can I feel it? Okay. Let me know if you feel any pain. Okay, take a deep breath in, hold, okay, release. Okay, now cough for me, and again. Okay, any pain or anything? Perfect. Okay, let's check your reflexes. Tummy feels fine. I can't feel any swelling, any hernias or anything like that. Okay, right, if you just droop your arm for me, let it flop. Good. This side. Good. Okay, droop your legs. Okay. Perfect. All good. Right, I'm going to have a little look in your eyes, okay? Now bear in mind I'm not an optician, but I can see if there's anything medically going on, alright? But if I am concerned, obviously I would suggest you go to an optician. Okay. Now with your eyes, just look up. Look left. Look right. And back at me. They look nice and clear. Look there for me. Keep looking there with your eyes, that's it. Okay, lovely. Excellent, my love. Okay, right. Just relax for me, okay? Your eyes are clear and nice and healthy, okay? Okay, that's fine. Now, what do you like with blood tests? Are you okay? Okay. I want to take your blood pressure. Okay, pop your arm in there. That's it, like so. Thank you. Now relax for me. Okay, that's pretty good. Okay. That's in the normal range. Okay. No issues there. Okay. Right. So how are you with blood? Okay. So if you can just do that for me. Okay, just squeezing both sides. Whilst you're doing that, I'm just going to have a feel down your legs. Okay. Any pain anywhere, my love? Okay. Okay. Sway. Okay, good. That's fine. Okay, that's fine. Right. So pop that there. Okay, let me have a feel, my love. Okay. Okay. Just relax for me. Okay, my love. So I'm going to take your blood in a moment, okay? Just gradually, just sit a little bit with your hands like that, okay? Just want to ask a few questions first, just because I'm doing the blood. Obviously, I need to know if I need to add anything else on. Okay, so are you experiencing any symptoms of anything that you want me to take a look at or anything like that? Okay. Okay, so when you say tired, how tired? Okay, so you're feeling quite lethargic. So you're quite fatigued. Okay. Headaches. Okay. How often are you getting headaches? Okay. Yeah. Okay. And okay, so how often are you actually going to the toilet then? Okay, so about once a week. Okay, that's not very much. Okay, you're getting enough fibre, or do you have IBS? Okay. How's your waterworks? Going regular, or are we going quite a lot? Okay, it's quite excessive. Any pain, burning, sting, or anything like that? Okay, that's good. Okay, that's great. Okay. So you've just been getting a bit achy everywhere. So we're talking quite a lot of pain, or? Yeah. Okay. How long have you experienced that? Okay. Yeah. All right, lovely. Okay. So you say you can't lose weight. Okay. Would you say you've gained weight as well, or? Yeah. Okay. So weight gain, struggling to lose weight. Okay. Are you actively trying to lose weight? Okay. What kind of things are you doing? Yeah. Okay. So quite some time then. All right. Well, do you mind just popping on the scales for me, just over there? Thank you very much. Now let's just have a look what weight you were before. Okay, so okay. Okay, my lovely. You can sit back down. Okay, yes, there is a considerable amount of gain, but I'm more kind of concerned about the losing the weight than necessarily popping the weight on. Yeah, obviously we've had Christmas, different things like that. You know, colder months usually people exercise less, move less, and different things like that. So, but you know, I do think that we might need to check, see if your thyroid's working okay. How are you with your libido? Is that okay? Is it low or? Okay, so is that a sudden change for you? Okay, so low libido. Yeah, that must be quite difficult for you. Yeah. Yeah, especially if you've gone from, say, being quite active and then, yeah. Okay, you're in a relationship. Okay, and how are things? Well, that's good. Are they understanding or? Yeah, well, that's great. I'm glad to hear that. So understanding. Keep talking as well and communicating, all right? Make sure you're telling them how you feel. Yeah, and how, what's bothering you and different things like that. Just be open with how you feel mentally and physically and things like that. Okay, I think it's important. Just try to spend some time together, and try to start from basics and work your way up and things like that. There's definitely some things out there that are worth looking at to try and help improve libido, mood and things like that. Okay, so how would you say your mood is normally then? Would you say you've got quite a low mood? Is it, up and down? Okay, low mood, but up and down as well. Okay. Let me just remind me, do you have a history of mental health? Oh, yeah, okay. Okay, so you are on those. Are you still taking those medications? You are, okay. And how are you feel getting on with them? It's been quite some time, hasn't it? Okay, do you feel like you could do with a review on your medication or? Okay. I mean, I can review them, but I think with some of the medication that you are on, it's probably better to see maybe more a psychiatrist to assess those individually. Yeah, you can only mess with certain levels of medication, but I'm not necessarily thinking that it's your depression and that's causing it. I'm wondering if you have an underactive thyroid. Yes, because you've got the fatigue, the tiredness, the constipation, struggling with the weight. You've got some chronic pain and you've got low libido and low mood, a bit of depression. Yeah, exactly. Expected underactive thyroid. Okay. So, it could well be that. It could be other things. Alright, I mean, you could be anemic. So we'll have to check your iron levels, okay, and we'll have to check obviously the thyroid as well, and a couple of other things that we'll be checking with the bloods. Now, you haven't got a puffy face, you're not massively overweight, you haven't got any changes in your voice or anything like that. Yeah, because that can happen if it's left untreated. You can have hearing problems and things, and your hearing sounds fine. So if it is that, it could be early, very minimal, but we can get it treated. Okay. Right. Okay, so I want to check vitamin D and calcium, sodium. I want to check your thyroid, glucose. I want to check your iron levels. B12, B9, that full blood count. I want to do cholesterol. Do a diabetes check on you as well. And a couple of other things. Your That's it, yeah, that's good. Okay, I'll get the form out and I'll have a look through and I'll just take anything relevant. Okay, good. So I'll do your bloods in a moment and check your urine, see if your urine is showing up any infection or anything like that. Okay, that's fine. So I'll go back to that page. Now, I know we've briefly touched on mood and things, but how are you in yourself? Are you feeling fine? Not too bad? Are you struggling at the moment, or? Okay. So how's, yeah, okay. Yeah. Yeah. Okay. Yeah, I could definitely probably look at your medication. I mean, you've not had an increase for a while. Let me just see. Okay, I could up the antidepressant slightly for you, okay, and see how we get on. But other than that, I would need to get you to the mental health team. And I can do that as well. Okay. Right, so I'm going to up that slightly. Okay, it's not going to be a lot. 25 on that one. And then I'm going to get you into the mental health team. Okay. And you can go and see somebody. And then they can do a nice assessment on you, okay? Just to make sure. But obviously in the meantime, testing all these things. All right, we just have to be careful because you do have a history of obviously mental health issues. You are on mental health medication. So, yeah, exactly. Right, my love, let me just get... Okay. Right, so blood form and medication. Okay. That is for you, my lovely. Thank you very much. Now I need to tick off these bloods. Perfect. Right, so that is ready for me to do. Okay, let's do a couple of more pumps for me with your hand. Do you have any questions at all? Okay. Okay, let me have a feel. This one. Okay, on to the other one. Thank you. Right, this is just just going to cleanse the area. Okay. 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 Overall, I'm impressed with everything. Not particularly concerned about anything apart from obviously thyroid or, you know, your mental health and things. I mean, if it is something with your mental health, it could be that's affecting your libido. Yeah, and obviously again that could be affecting like weight and food intake and different things like that. Okay. Okay, that's that done. Right, my love. Let me just check. Oh yes, good. Okay, it'll be 3 bottles today. All right, 1, 2, 3. Yes, that's fine. Okay. Okay. Relax for me. Okay. Nice breath. Sharp scratch. Thank you. Really well. Good. And last one. Okay. And go. How was that? Not too bad. Good. Now, if you can just put a lot of pressure on that for me, thank you. Okay, keep doing that for me. Excellent. Okay, and pop the blood form in there too. That's good. That will go today. Right, let me just have a look at your... Oh, that's lovely. Okay, I'm just going to pop you these little patches on, okay. Wonderful. There we go, my love. Right, I'm going to check your urine to finish. Leave that to do. Right, so any questions for me? Okay. Now I'm going to send these off. If there is any problems, you will get a call. Alright, but if you don't hear anything, assume everything's fine, but if you would like to just check anyway, just give us a ring. Alright, just in case. Okay. Yeah, I've tested a few on your hormones. Alright, I'm wondering whether you could do with seeing an endocrinologist or something like that, okay? There might be other things going on with other hormones and that, okay? Especially the things that you've described to me. Alright, my love. Right, let me have a look at you. Absolutely perfect. Excellent. No problems there at all. There we go. Pop that in the bin. Brilliant. Okay, so we'll pass all this on as well and pass you over to the mental health team. You've got your prescription. Please start taking that ASAP. Okay. And then if there is any problems, obviously, with the bloods, we can get you treated accordingly. All right, my lovely. Okay, so are you happy with everything? Good. You are very welcome, my lovely. I'm happy with everything and the plan going forward. All right, and I will be in touch. All right. You're very welcome. You take care now. Bye-bye. Hello.
Hello.
How are you?
I'm good, thank you. How are you?
I'm good, thanks.
Good.
It's nice to meet you.
And you?
I'm Dr. Nicola, and I'll be carrying out your skin assessment today.
Okay, lovely.
Okay. Now, before we actually get into the exam, I just want to ask you a couple of questions. Is that all right?
Yeah, of course.
Great. So, can I just get you to confirm your name?
Jodie.
Thank you. And your date of birth?
9th of the 12th.
Yeah.
1989.
Thank you. Right, first of all, I want to say, have you had one of these done before?
I have, but it's been about a good 12 months.
Okay. Okay, that's fine. Now, do you have any current concerns with your skin on your face?
It tends to be quite dry on my nose and cheeks, and
Yeah.
quite oily on my chin and forehead.
And T-zone oily. Okay. So, are you wanting to find something to help balance out your skin so it's not T-zone, not oily, not too dry on the cheeks?
Yeah, I'd like that, please.
Okay. Now, do you use any skincare at the moment?
Yeah, I've got a very basic skincare routine because I get worried because of how sensitive my skin is. I don't like the dryness to get any worse or the oiliness, so I have to be careful what I use.
Yeah.
So yeah, general just face wash and moisturiser.
Okay. It's quite basic routine. Wash and a moisturiser.
Yeah, toners tend to really dry out my skin.
Okay, yeah. So toners. And do you exfoliate at all?
As on occasion, yeah, but only once a month because again, it brings out spots and dryness.
So when you say your skin is sensitive, do you go red, inflamed, or do you just come out in breakouts?
Breakouts and sometimes red.
Okay, makes sense.
And the dryness gets worse.
Yeah. Okay. Right, so that brings me on to any allergies. Do you have any allergies at all?
Apart from hay fever, not that I know to.
Okay. And how's your hay fever today? Is it not too bad?
Yeah, not too bad today.
Okay. Now, have you ever had acne?
I have suffered with it when I was younger.
So,
Not a lot of it, but I had quite a few on my chin.
so quite hormonal, probably.
Yeah.
Okay. Now, have you had any facial treatments at all?
It's probably been about 12 months.
Is that just a basic facial cleanse, tone, moisturise, etc.? Okay. Now, do you drink a lot of water?
Yeah.
Okay, so you say you're getting enough throughout the day?
Yeah.
So you're very good like that?
Because that's all I really drink is water. I don't drink squash or...
Okay, that's really good.
Yeah.
So you don't really have caffeine or anything like that?
Very rarely. I do enjoy a coffee, but it's literally only when I go out.
Yeah, that's good. Do you drink any alcohol at all?
Again, rarely.
So rarely drink. Okay, and what about any cigarettes or anything like that?
No, I don't smoke.
Okay, that's good. Right, now do you have any special dietary requirements?
So I am vegan, so I don't eat meat or
Okay.
consume dairy products.
So no dairy products or anything at all?
Yeah.
Okay. Now, do you take any supplements?
Yeah, because I exercise a lot. I do take iron and B12.
Okay, exercise, B12, and iron. And other than that, do you take any other medication?
Apart from a contraceptive pill now.
And are you alright with that? Do you find that you get any breakouts with that? Or...
It's helped actually.
Oh, it has? Okay,
Yeah.
That's really good. So it helps. Okay, that's interesting. So it's obviously balanced your hormones out and it's not flaring. Yeah, that's really good. Great. Now, is there anything else I should be made aware of?
Not that I know to.
Okay, perfect. Now, if you do think of anything whilst I'm examining, please just ask or tell me. That's perfectly fine, okay?
Yeah.
Right, so that's good. What I'm going to do is I'm going to pop some gloves on for the exam, okay? Right, let's get these on. If you wouldn't mind popping on this headband for me, just so I can get your hair off your face, thank you. Yeah, that's perfectly fine, thank you. Right, so what I'm going to do first is literally just have a look. Okay, now do you have anything on your face today?
I've got mascara and a bit of eyebrow makeup.
Okay, but
and lip gloss, but nothing on my
else.
actual face.
Okay, that's fine. And have you put any skincare on today?
Wash my face and moisturise.
Okay, that's good. Now, I'm literally just going to feel your face first. Just see if I can feel any lumps or bumps. Okay, so it feels okay. I'm going to start looking at your forehead first. That feel okay? Okay, I'm just going to look at your nose area now. A little bit of a breakout there. But as I said, if you do get an oily T-zone, that's obviously quite common. Now, looking at your nose, it does appear quite dry here, and it appears to look tight, if that makes sense. Does it ever feel quite tight in that area?
Sometimes, yeah.
Okay. Now, it looks dry, but not as in peeling skin, flaky skin or anything like that. Do you ever get any peeling or dry patch? You do, yeah. Okay. And when I scrunch like that, you can see loads of little lines, which shows to me as well that your nose is quite dehydrated. And that can be causing these little lines here. Okay. And you do have pigmentation, but not a great deal. Okay, it's a little bit red, and especially now I've been touching, it has gone quite red. Do you find you get that a lot? Yeah, and do you burn easily in the sun?
Yeah.
Okay.
Is it known as rosacea?
Rosacea, yeah. Obviously, when we are touching anyway, we are prone to get erythema, which is reddening of the skin. But some people with rosacea have always got like red patches, and sometimes it looks lumpy. But it just shows that your skin's probably quite sensitive.
Which it is.
You do have a couple of broken capillaries, which are like your thread veins. Not so many on this one, but
you know that was a contraception that caused that.
really,
Yeah.
no way.
Yeah, you know the injection. I had the injection when I was like 21, and it caused lots of little veins all over my body.
That's so
So like
weird.
lots in my face, my nose, and all over my legs. They've disappeared a bit since I've not had it, but the ones on my face stayed.
Yeah, they're not excessive.
Yeah, just
but if I'm
bits.
really looking, obviously I can see.
Mm.
So I'm wondering over time, as that's kind of gone out your system, and then now you're on your obviously new medication, maybe that's balancing it a little bit more as well. So
Interesting though.
okay. Now there's a couple enlarged pores, but nothing too excessive, which is really good. So you don't really have a lot of blackheads. You do have a few, especially around here, and they're probably quite embedded in, but nothing too excessive. Got quite an enlarged pore there, but the good thing is there's nothing in it, which is good. Now I'm going to look at this side and just feel. Okay. And this side. Okay, I'm just going. So they come down slightly there, but the top lip looks quite smooth. A little bit of breakouts on the chin area. Again, going a little bit red. A little bit bumpy, that's quite hormonal related. A couple of pigmentation there. Tie that back. Okay. Yeah, a couple of blackheads here, which is quite common in obviously the T-zone, and because you have got breakouts there, the chance of you having blackheads in that area is obviously quite high. They're not like, you don't look at you and think, oh my goodness, but I can see them while I'm examining. A little enlarged pore there. Okay. Relax a little bit. Okay, if you can turn that way. Now when I'm going like that, I can see the dehydration lines. They get more prominent as I push. We've got a bounce, which is good in the skin, but I can really feel where it's quite tight and it's struggling to give me that smooth bounce. Okay, so you said you notice the oiliness. When in the day do you get it?
So with me, it's hard to find a balance between it being dry and overly moisturised and oily. So when it's dry, I'll moisturise, but then it gets oily. And at the same time, I get sometimes like flakiness, even though it's oily.
Yeah. So when you have combination skin, it is quite difficult to try and find products that suit. And it's always best to treat the main issue. So the thing is, when we use moisturisers, if you're using an oil-based moisturiser, you're going to look oily if you're prone to oily skin. So try to avoid an oil base. And also if you use like silicone base, again, you can appear oily with that. So try to avoid anything like that. But if you are getting oily from moisturisers, well, you may be using too much. Or if you're getting oily, it's because you're using the wrong type of moisturiser. That's usually what I find. Obviously, if it's warm out and your skin's going to be hot, then you might look oily because of that. But yeah, it's about finding the right balance of skincare, really. But if you're having something and it's drying your skin out too much, then you're going to get dry patches, and then it's going to be worse. So possibly look at a range that is specifically for dry skin, but then make sure you're using not a heavy moisturiser, because some of them are really heavy, especially nighttime creams. So my advice would be to don't put anything too heavy on your face.
Okay.
If that makes sense. Yeah. Because obviously we need to get the moisture back in to stop it from being so dry, but obviously we don't want to be overloading it too much and then making you look oily, because
spotty,
and that gets spotty then. So a bit of pigmentation dotted around. You can just turn that way for me. So is this like a mole or a freckle?
I think it's a mole.
It's not raised, which is good. We should always make sure that we are checking any moles and freckles or pigmentation patches if they get any bigger or anything like that.
Okay.
Some lines around the eyes, but if you are quite dry, you're going to be prone to that, because you'll find that people, if they have oilier skin, they're less likely to get wrinkles. So do you know what I mean? If that makes sense. I'm just going to get my light. Just have a look. Yeah, so you don't really have many blackheads at all. It's really just here on this side. Which is good. Okay.
Some good news at least.
Yeah. I'm going to bring in my purple light.
This is going to show how much sun damage I've got.
Yeah. Yeah, you can definitely see underneath. And obviously the freckles that you can't see, I can see with this light. Oops, sorry. Okay. And all the patches like there. So you seem to catch the sun here.
Mm-hmm.
This is where it's mainly going, and on your nose. You can see little bits of dead skin on here. And you said you only exfoliate once a month.
Mm-hmm.
So like here I can see blackheads underneath the skin, which potentially look like they could form into an actual spot. Okay. Now, you said you only exfoliate once a month. I would recommend that you do it once a week. But don't use something abrasive. It can't be rough, because if you're doing that, you're going to dry your skin out, you're going to cut your skin, and it's not going to be a pleasant experience. So my advice would be use something more like a paste maybe, or like a soft jelly kind of exfoliator, whichever you can find to suit the products that you can and can't use. You look into them, but something like that, and make sure you're using it once a month. Now, I mean once a week. Also, my advice is, after you've used an exfoliator, to pop on a mask. Now, there are so many different sheet masks out there, and that are perfectly okay to use. And then you just pop the sheet mask on. So what that will do, that will really put the moisture into your pores, and then it will help hydrate your skin, help with it. If you get a brightening one, it will help with pigmentation as well. And then I know you said you can't really use a toner, so if you can't find the right toner for your skin, then just splash your face with cold water, and that's going to help close your pores. So we exfoliate to remove all the dead skin, then we pop in the moisture so it's all nice, and then we block it so we don't get any blackheads or anything like that. You need to be quite consistent with it though, and try to do that every week. And that's really going to help them. But look for some sheet masks that are good for moisture, hydration and brightening. Those are the ones that you need to be looking at. Okay. Yeah, that's fine. Okay. Alright, I'm just going to gently tap your face. Okay, it won't hurt. Does that feel okay?
Cold.
Yeah. I'm just watching how the skin bounces back. Okay. So the areas where we are quite dry, it's slower at bouncing back. You can see it. I'm just going to use the bigger end. And obviously if we're dry, that can make our skin look dull. Yeah, okay. Now I'm going to pop some air on your face. Okay. Is that alright? Just watching your skin as it moves. You can definitely see the drier areas are definitely here. Now I'm just going to look under your eyes. Can you look up for me? Okay, close. Thank you. So under your eye, I mean, it's great. You don't really have any dark circles, which is really good. And you don't have any bags or anything like that. Your eye area looks quite fresh. But it's very tight here, I can see, and obviously that's going to be pushing here and causing these fine lines. Do you use an eye cream? You've got to use an eye cream. If you don't want to use a cream, use a serum. Okay, like a hydrating serum or something like that. And always go out, tap. Or circles out. Now, some creams can be quite heavy, so it's finding the right one for you. A nice thin cream, if it's nice and cold, that would be nice as well, and it's really good for circulation. My advice would be to use an eye cream, but that's personal preference. That's really going to help hydrate all this area here, because as you put on the cream, you're going to be going like this. So literally, if you concentrate on this section with a serum, a cream, a gel, something like
Those
that.
like gel patches. They work.
Yeah, if you've got, you can get eye patches. Now I use them all the time. They're really good for hydrating, and some depuff and different things like that. Some help with dark circles. You can use those as often as you like. Me, I always have them on if I'm doing makeup, and once if I exfoliate, use an eye patches and a full mask as well. So do whatever works for you, but that's great. And you'll see that if you, especially when you put a mask on, if it goes warm and it's quite dry, you know your face is lacking moisture. But then I always recommend for people to have an eye cream, and especially if you are getting dry here, because I can see the dryness. So if you get yourself an eye cream, have a Google around, see what's appropriate, different things like that. Personally, I would probably say nothing too heavy to start with. A nice serum based one, a gel based one, or something quite water based is what I think you should be doing. Okay. I mean, it all depends on how much you want to go into what you use at the end of the day. Sometimes, yeah, people saying I'm basic because I fear this is going to happen, but then sometimes the basic is not helping, if you know what I mean. So just try to have a look round and what you feel like. Right, can you smile for me? Okay, can you frown? Okay, and just can you puff your cheeks a little bit? Okay, relax. Okay, I'm just going to just take measure. Now I'm just going to gently squeeze areas of your face. Does that feel okay? Sorry. Didn't hurt, did it? Just turn that way. Yeah, your skin's quite tight. a couple of samples, my love. Okay.
Mm-hmm.
Okay. And when we are applying any products, we must make sure we're going upwards. Up, up, like so. And circular motions. Okay.
Yeah, thank you.
Okay, do you have any questions?
No, I think I'm okay. You've
So-
been very thorough, thank you very much.
You're welcome. So what I suggest is possibly coming in for a facial treatment, working on hydration, we can get rid of any blackheads and anything like that. And I would say definitely look at your home skincare routine.
Yeah.
And just keep up with what you're doing and just make sure you wear SPF.
Yeah.
Okay.
Mm-hmm.
I will do a full report and I will send it over to you.
Thank you.
You're very welcome. So if you do want to book any appointments, if you see my receptionist, she'll be able to help that out for you.
I will do. Thank you so much.
Thank you so much.
Bye-bye.
Bye.